So in your lab, what kind of, I mean, like, I'm not going, like, we're not like, you don't have to go into details and the molecules that you are working on. It does like a brief.
I will not, Douina, I will not.
Like, how is like, what is the main interest of the lab, and what is this type of sample that you are working on? And I mean,
Sure. Yeah, so what we're trying to do in the lab, we're lucky to have great collaborators as surgeons. So we're working on fresh samples, human samples, mainly from glioma samples, including glioblastoma, and also different different stages of breast cancer as well. What we try to do is to understand the stages, or how come that some patients or in some patients the immune system can do a good job, and by stopping the progression and development of tumor cells, and in other patients the immune system fails to do that. Our focus is understanding and checking the expression of a different type of immune checkpoints, including the new immune checkpoints that have been discovered, and we'll talk here about VISTA, CHIM3, and so on. We are lucky, as I said in the beginning, to have these fresh, human tumors, and we try to basically identify some new immune checkpoints and how they are expressed depending or according to the stages, different stages of cancer developments. This is one first step, is to see which type of immune cells are expressed. Another theme is to check and to try to find out some chemicals, some small drug chemicals, mainly from natural substances, which could basically block or inhibit this immune checkpoint, this newly discovered immune checkpoint. And the goal, of course, is to do what other people are doing with antibodies, and to see whether we can improve the immune system cells. This is another, we're doing this through bioinformatics, and after that we confirm that in vitro and in mice as well. So this is a second step. And then a third team is we're working in collaboration with some artificial intelligence, scientists, trying to understand whether we could predict patients which could respond to immunotherapy from patients who could not respond to immunotherapy. This, of course, because we give, so far immunotherapy based approaches, and antibodies to many patients who would not respond. And as you know, the immunotherapy approach is extremely expensive. Also, it's time consuming. So there is no point of giving an immunotherapy or immunotherapy antibodies to a patient who will not respond to, or who has a really low likelihood to respond. So this is mainly the themes that we are tackling here in the lab.